dear students, I am Dr. Pratyusha. In this video, let us look at a very interesting concept that is otalgia or ear pain. This is one of the most common complaints in the ENT OPD, and this is a very conceptual topic that requires a good theoretical understanding as well as conceptual application. So otalgia is ear ache. And otalgia could be primary otalgia as well as secondary otalgia. Primary otalgia is ear pain that is arising out of some pathology in the ear itself. Secondary otalgia is ear pain that occurs due to pathology elsewhere in the head and neck. That is secondary ear pain or referred ear pain. And why does that occur? Because of the common nerve supply. You already know about the nerve supply of ear, that the nerve is supplied by multiple nerves, and any pathology anywhere in the path of the nerve could lead to pain in the ear. It can present as pain in the ear. So there are so many causes for pain in the ear, and let us look at all of them one by one and discuss them. Before getting into the topic of otalgia, as I told you, the nerve supply of ear is very much responsible for all these conditions. Let us quickly brush up the nerve supply first and then go into otalgia in detail. The ear is supplied by 4 cranial nerves as well as 2 cervical nerves. What are the 4 cranial nerves? 5th nerve, 7th nerve, 9th and 10th nerves. What are the branches that are supplying them? First is the auriculotemporal nerve. Auriculotemporal nerve is a branch of the mandibular division of trigeminal nerve. It's coming from the mandibular division. And what all is the auriculotemporal nerve supplying? It is supplying the tragus. It is supplying the anterior wall of external auditory canal. And going into the tympanic membrane, it is supplying the anterior portion of lateral surface of the tympanic membrane. Along with this, it is also supplying the crust of the helix. I told you how to remember this, auriculotemporal. It is supplying the temple and then the auricle. So the part of the auricle that is in continuation with the temple is supplied by auriculotemporal nerve. You can understand this by looking at this picture. So please look at this picture. And this entire part that is being shown in green color, this part of the pinna, and all this in the external auditory canal, plus the anterior half of the lateral surface of tympanic membrane. All of this is supplied by auriculotemporal nerve. This is about the auriculotemporal nerve. There is another nerve that is the posterior auricular nerve. The posterior auricular nerve, this is the first extracranial branch of the facial nerve. This supplies the posterior wall of external auditory canal and then the posterolateral surface of tympanic membrane. In the lateral surface, we have the anterior half which is supplied by auriculotemporal nerve and the posterior half is supplied by the branch of facial nerve. And also the posterior skin of auricle is supplied by this branch. Then we have the Jacobson's nerve. Jacobson's nerve, I also told you a mnemonic to remember that. What is it? J sound. What is the nerve that has the same sound? It is the glossopharyngeal nerve. It's a branch of the 9th cranial nerve. Jacobson's nerve is also called as the tympanic branch of glossopharyngeal nerve. This supplies the middle ear, upper part of the eustachian tube, and also the medial surface of tympanic membrane, plus mastoid air cells. So a lot in the middle ear. Medial surface of tympanic membrane, mastoid air cells, upper part of eustachian tube and the entire middle ear. And then we have Arnold's nerve. Arnold's nerve is a branch of, I told you to remember, reverse this A and you will get V. It's a branch of the 10th cranial nerve. It's called as the auricular branch of vagus. This supplies the inferior and posterior aspects of the external auditory canal, plus it supplies the concavity of the concha and the lateral surface of tympanic membrane. And the 5th one is the greater auricular nerve. Great auricular nerve supplies the maximum part of the pinna. It also supplies the posterior auricle, the skin overlying the mastoid and the parotid glands. Then the last one is lesser occipital nerve. This supplies only a small part. It's a branch of C2C3. Both of them are branches of C2C3. Great auricular nerve as well as lesser occipital nerve. Lesser occipital nerve supplies the superior part of the pinna. Along with that, it supplies the posterolateral scalp and the supraauricular scalp region. So I hope the nerve supply of ear has come back to you. And now repeat. So I hope you have recapped the nerve supply of ear. Now let's get back to our parent topic, Otalgia. What are the features of Otalgia? Now there are so many causes for ear pain and your job is to localize the cause of the pain. And for that, a good history taking and examination is of paramount importance. So I'll tell you step by step what you have to ask in history and how to arrive at the diagnosis. So let's begin with history taking. The first question you will ask is about the onset of pain. And what will you get to know by this? If it is a sudden onset ear pain, it could be because of furunculosis, it could be because of acute otitis media, it could be because of barotrauma, aero-otitis media, the one that happens in air travel commonly, descent of air travel. This is if it is sudden. Ear pain could also be gradual. When is gradual pain seen? In otitis externa, that is secondary to CSOM. If there is any malignant condition of the ear, that will also take a very gradual onset. So you have asked about the onset. Next, you will ask about the duration of pain. In case it is of short duration, it could be acute suppurative otitis media, it could be perichondritis of the pinna or any acute condition. Whereas if it is a long-term pain, again think about malignancy. Then we will ask about the nature of pain. If it is a dull type of pain, it could be an impacted wax that is causing pain. It could be secretory type of otitis media. It could be an eczematous otitis externa also. All of them will cause a dull sort of pain. If it is a sharp pain, what does it indicate? Barotrauma causes sharp excruciating pain. Even furunculosis causes a sharp pain. There is another type of pain called as throbbing pain. In which condition is throbbing pain seen? ASOM, acute suppurative otitis media. Next, you will ask about aggravating and relieving factors. And what you must remember here is, so relieving factor in ASOM is with the outcome of discharge. Discharge relieves pain in ASOM. Coming to aggravating factors, if the pain increases on swallowing, it is ASOM. If the pain increases on yawning and chewing, it is a pain that is caused because it is a pain that is either caused by temporomandibular joint pathology, TMJ pathology, or when there is a furunculosis from the anterior wall of external auditory canal, that can also get aggravated on yawning and chewing. So these are various factors you will get to know by asking relevant history. Now let us look into the types of otalgia and discuss the causes. First, let us speak about primary otalgia. What is primary otalgia? Ear pain that occurs due to some ear pathology only. Pain is arising from the ear. And what are the causes of primary otalgia? The causes can begin from the pinna itself. What all can happen to the pinna? Any trauma to the pinna, hematoma, herpes zoster otiticus, any malignancy, any perichondritis, chronic relapsing perichondritis, cellulitis in the pinna, and there is a condition called as chondrodermatitis nodularis helicis. I hope you remember that small nodules are formed all over the helix on the pinna. That's a painful condition. Any of the disorders of the pinna can cause pain in the ear. Next, external auditory canal pathologies. Otitis externa, acute otitis externa, chronic otitis externa, necrotizing type, benign type, malignancy in the external auditory canal. Anything can cause pain. Furuncle, keratosis, obturans, any meningitis, any trauma, again herpes zoster oticus, either in the pinna or in the external auditory canal, can cause pain. Yes. Then we have tympanic membrane pathologies, that is bullous meningitis. And then let's move on to middle ear pathologies. Otitis media is the most common cause, the most common pathology in middle ear. Even inner ear causes noise discomfort can also cause ear pain. So these are all the pathologies in the ear that can cause ear pain. After studying the entire ear, this will look like the headings of all the chapters. Anything in any pathology in the ear, the most common complaint is ear pain. This is very simple. Now let us move on to the second part, and that is secondary otalgia. The secondary otalgia is also called as referred otalgia, referred pain. This is where you need all the knowledge regarding the nerve supply. So secondary otalgia or referred pain in the ear occurs because of pathologies in the head and neck regions because of the common innervation. Common innervation is what you must remember and understand. So the nerves supplying various structures in the head and neck region, they also supply the ear and they cause referred pain in the ear. We have already studied the nerve supply just now, so it becomes very easy for us. Let's begin again with the auriculotemporal nerve. Auriculotemporal nerve, or what structures it supplies in the ear, you already know. Apart from that, it also supplies the neck of the mandible, sphenomandibular ligament, temporomandibular joint, parotid gland, nose and paranasal sinuses. Should I write all of them down for you? Repeat. I will write them down for you. So it supplies neck of mandible, sphenomandibular ligament, temporomandibular joint, parotid gland, nose and paranasal sinuses. So any tooth caries, dental problems, oral cavity disorders, salivary gland inflammations and tumors, sphenopalatine neuralgia, all of these will cause ear pain. Why? Because of the auriculotemporal nerve. You can remember these structures and then think about the pathologies. Tooth caries, dental problems, any problem in the oral cavity, any problem in the salivary gland, sphenopalatine neuralgia, all of them will cause ear pain because of auriculotemporal nerve. Let us look into the next nerve, and that is posterior auricular nerve. It supplies the posterior wall of It supplies the posterior wall of external auditory canal, posterolateral surface of tympanic membrane, posterior skin of auricle, posterior auricular muscles and some intrinsic muscles of auricle. Apart from that, it also supplies the stylomastoid foramen, occipitalis muscle, cerebellopontine angle. So any geniculate neuralgia, Bell's palsy, herpes zoster oticus, all of them can cause ear pain because of posterior auricular nerve. Next we have the Jacobson's nerve. It is the branch of glossopharyngeal nerve and it is supplying the upper part of eustachian tube, the medial surface of tympanic membrane, mastoid air cells and the middle ear. Apart from that, it also supplies parotid gland, tonsils, serous glands of oral cavity, posterior 1/3 of tongue, anterior 2/3 of tongue is by chorda tympani of facial nerve, posterior 1/3 is by glossopharyngeal nerve, pharyngeal plexus, styloid process and carotid sinus. So any pathologies regarding these structures such as your acute tonsillitis, peritonsillar abscess, post-tonsillectomy, and then pathologies of the soft palate such as benign and malignant ulcers in the soft palate, in the tonsils, in the pillars of tonsils, in the base of the tongue, Eagle's syndrome which is elongated styloid process and glossopharyngeal neuralgia, all of them can cause pain in the ear because of Jacobson's nerve. And then we have Arnold's nerve. So we know that Arnold's nerve is supplying the inferior and posterior aspects of external auditory canal, the concavity of the concha and the posterior half of the lateral surface of tympanic membrane. Apart from that, it supplies the upper aerodigestive tract, it supplies the epiglottis, larynx, laryngopharynx, thyroid as well as vallecula. It supplies upper aerodigestive tract, larynx, epiglottis, vallecula, laryngopharynx. I am giving all these in detail because any of the terminology can be used in MCQ. Sometimes they say larynx, sometimes they say epiglottis. Suddenly it might not occur to you that epiglottis is also part of the larynx. It's one of the laryngeal cartilage. So just for you to feel familiar, I'm writing the entire list. And thyroid also. Okay. So malignancies or ulcerative lesions in any of the above areas, thyroiditis, thyroid tumors, GERD, coronary artery disease, all of them can cause secondary otalgia because of Arnold's nerve. Even GERD, gastroesophageal reflux disease, can present with ear pain because of the common nerve supply, that is by the vagus. And then the next nerve is the greater repeat. And then we have greater auricular and lesser occipital nerves. These are mainly supplying the pinna. They are branches of C2 and C3. They supply the posterior auricle and the superior part of pinna. Apart from that, they also supply the cervical vertebra, skin overlying the mastoid and parotid glands and the posterolateral scalp. So because of that, what problem can occur with the cervical vertebrae? Cervical spondylosis, any cervical spine degenerative diseases, cervical meningitis, caries of the spine, trauma, whiplash injury, that is your neck injury because of forceful rapid back and forth movement of the neck. All of them can cause secondary otalgia because of the greater auricular and lesser occipital nerves. Apart from these, we have certain miscellaneous causes also that can lead to secondary otalgia. Inflammatory conditions of the pharynx, larynx, pharyngitis, laryngitis, any parapharyngeal space infections or tumors, any pathologies related to the major salivary glands, any cervical lymph node pathologies and thyroid problems. All of these, to summarize, will cause secondary otalgia. Apart from that, there is something called as cholesterol granuloma. It's an uncommon benign cyst that occurs in the petrous apex, which is a part of the temporal bone. That can also cause secondary otalgia. Now you have understood the various causes and how to take history. Now let us see how to elicit this in our examination. Before we look into the examination, let us quickly summarize all the causes of secondary otalgia with the help of a picture. So in this picture, you can see the ear and the various nerves supplying the ear along with the other structures supplied by those nerves. Let's begin with our fifth nerve, auriculotemporal nerve. As you can see in this picture, any pathology of the teeth, dental problems can cause secondary otalgia. Temporomandibular joint pathologies like bruxism, any ulcer in the tongue and soft palate can also cause secondary otalgia. And then you have greater auricular and lesser occipital nerves, which are branches of C2 and C3. So any pathology in the cervical spine, cervical vertebral pathologies can lead to ear pain, secondary ear pain. And then let us look into the 10th nerve, vagus nerve, which is mainly supplying the larynx. So any laryngeal pathologies can lead to referred pain in the ear. Coming to the 9th nerve, that is glossopharyngeal nerve. Any pathology in the posterior 1/3 of the tongue, pharynx, and as you can see in this picture, all these structures can lead to secondary pain in the ear. I hope this comprehensive diagram has made it clear for you. Alright. Let us now look into the examination. Part. After taking a detailed history, we will move on to examination. First, you will examine the ear to find out the primary otalgia causes. You have to extensively examine the pinna, the preauricular area, postauricular area, external auditory canal as well as the tympanic membrane. With this, you can understand if there is any primary pathology in the ear. After that, examine the nose. Look for the septum, for the turbinates, for the eustachian tube and for the nasopharynx and also the paranasal sinuses. With this, you can rule out the pathologies in the nose and paranasal sinuses. Then come to the oral cavity. We know that any dental caries can cause ear pain via the 5th nerve. Any problems in the soft palate and tongue can cause ear pain via the glossopharyngeal nerves. So look for all of them. Look for dental problems, look into the mucosa. Look into the mucosa of the oral cavity, into the soft palate and into the tongue. And then look into the oropharynx. Tonsillitis can also cause ear pain. So look for the tonsils, look for the tonsillar pillars, the posterior 1/3 of the tongue and the posterior pharyngeal wall. And then look into the larynx, examine the larynx by performing a laryngoscopy because via the 10th nerve, any pathology in the larynx, epiglottitis, any pathology in vallecula, aryepiglottic folds, arytenoids, vocal cords or any pyriform fossa pathology, any tumor there can also cause ear pain. And finally, look into the neck. What should you look into in the neck? Look for any lymph nodes, look for any muscle pain and also any other growths in the neck. With this, we complete the examination part and finally management. So after a detailed history and examination, we go for investigations. What investigations are done? Blood parameters are looked into to see if there is any occult infection, and then we go for otoendoscopy for a detailed. And then we go for otoendoscopy for a detailed picture of the external auditory canal, and tympanic membrane. And then eustachian tube function tests have to be done to rule out any disorders of the eustachian tube. A diagnostic nasal endoscopy is also done for the nasal pathologies. This is followed by laryngoscopy. Most of them are done in your clinical examination itself. I am just summarizing them again in investigations. Then we go for audiography to assess any hearing loss. This is followed by some investigations like a CT of the temporomandibular joint, and CT will also help us to look into sinus pathologies, into bony deformities, dental radiographs, cerebellopontine angle tumors. What is the most common tumor in the cerebellopontine angle? Acoustic neuroma. In case we are suspecting acoustic neuroma or any other intracranial tumor, an MRI is helpful. And if at all pus is present, culture and sensitivity of the pus or the other infectious fluid has to be done. So all these investigations need not be done in all the patients. Examination is must. Investigation, relevant investigation has to be done based on your history and examination. First, identification of the cause is the most important part to treat otalgia. Once you have identified the cause, treatment is very simple. Antimicrobials are the usual part of our treatment. If it's a bacterial infection, antibiotic. If it's a viral infection, antiviral. If it's a fungal infection, antifungals are given. And if it is GERD or esophagitis that is causing earache, then we can go for any of our pantoprazole or rabiprazole are good. Peptic ulcer disease treatment can be applied, and if it is because of myalgia or neuralgia, then NSAIDs will help in subsiding the pain, giving relief to the patient. So this is all about otalgia. The main take home message in otalgia is that you have to identify the cause of the ear pain, because there are so many causes, so many pathologies that can present with a single complaint, that is ear pain. So look for all the primary pathologies as an ENT specialist. Think of all the secondary pathologies also, keep them in your mind, secondary causes for otalgia, and proceed accordingly. So this is all about otalgia. Thank you very much.